that. And today, Dr. Lauer, one of our outstanding pediatricians, is going to join with us and help you navigate what that means for kids. I bet, it's just a guess, we might have some questions about school as well and some sports activities, Steve. So be prepared.
All right.
In the meantime, we'll have our ever faithful Doc Hawk back. How are we doing this morning, buddy?
We are good. We're the same that we have been. We
Thank you.
70 total patients, but 31 of those are acute active infections, 8 in the ICU and 2 on the ventilator. So a higher proportion on the vent, which is a good thing as well.
Yes, it is.
39 in that recovery period, but still with 3 on the ventilator. And Hayes has had, they have 18 patients total with 11 acute and 7 in that recovery phase. So they're kind of holding steady.
We're all just holding right in that area, are we? Hayes is doing that. We're doing that. We got down a little lower, kind of come up a little bit. Maybe this is our Super Bowl surge, and hopefully we're not going to see any more from that. I'm not going to say it was a favor that the Chiefs lost. I would never say that.
No.
But it may have limited some of the surge.
Yeah, and we know that around the world, and I'm sure you saw this around the world and in the United States overall, pretty good decline in active cases. So we should hopefully see even better numbers, I would hope, in the next 10, 12, 14 days as far as hospitalization goes, because we know those lag the number of infections.
And if you sit back, you have to ask yourself, why is the entire world going down? Has coronavirus become less infectious, Hawk?
No, I don't think so. And we know that those variants they really theorize that they are actually more contagious. So I think it's a number of different factors. I think, as you said, not vaccination really significant for the general population, but certainly in the nursing home population, in those vulnerable populations, because we know that it's not a significant number around the United States. A lot of behavioral things, more masking. We have very good data now, especially the last week or two, published data about what happens when the mask mandates were put in place. We know that decreases hospitalizations as well. I think it's a lot of behavior.
I think that's right, and I wonder if the people who weren't masking have been infected, and the people who weren't following the rules have been infected, the rules of infection control, and I just wonder if that's having an impact. If between 30 and 40% of our population here in the United States, and I don't know what it would be around the world, but if a lot of people who have practiced not the strongest rules of infection control have now had it, that's going to decrease the number of new cases. What do you think? Is that?
Yeah, I mean, that is one of the pieces. It's not one big answer. It is multiple answers, I think, and that is one of those answers there. That certainly, lend credence to. We've seen pictures. We've seen what was going on in the summer. There was a lot of behaviors there. Those behaviors are changed now for one reason or another as well. So I
don't think Party Cove's active at the Ozarks right now. It's just a thought, but I'm guessing not. I think if anything has changed, the winter storm that has gripped the United States has probably forced everybody indoors. You're staying within your bubble because you want to stay warm.
Yeah.
And we'll take that. That is a lot. There is some good about
that. That's a nature-induced shutdown, really.
Yeah, there you go. All right, let's see what questions are out there from reporters. Anybody?
Good morning, Cody Holyoke with Channel 9.
Cody.
Hey, guys. I've had some KMBC9 viewers reach out worried about the vaccination events being canceled specifically because of all the cold and the snow that we've had. Specifically, people who got their first shot are worried about delaying their second shot. I know that you guys get this a lot, too, but I'm curious. It bears repeating. Just your thoughts on that. Are they at any risk if it gets pushed a week or maybe a few days more than that?
The answer to that is no. You're not pushed. Remember that when especially Pfizer designed their trial, they looked to see the earliest possible time they could get that second shot in and settled at 3 weeks. Moderna went the more standard 4 weeks because that's what we've done with other trials. But the reality is you can go out quite a ways and still get a benefit. Some of you actually argued that the longer you wait, up to some point, probably several months, you actually get almost a better benefit by waiting a little longer. So I would not tell people who have been not been able to get their vaccination due to weather, the second shot, not to worry. As long as you get that sometime in the next month, you're going to be just fine. You'll get a great immune response. And the only thing you have to be worried about is it's that much longer until you have full immunity from the vaccination.
Yeah, exactly. The CDC guidance is at that second dose, really 4 days either way, so before or after that scheduled time. But really delaying, 2, 3, 4 weeks because of this type of issue is not going to be a big deal.
Yeah, not a big deal. And the good news is that as long as the vaccine is super cold, which I'm just guessing is not hard right now, unless you're part of a rolling blackout, but all those freezers all have backup generators, so we're fine. I think that the vaccine will still be there. It'll still be available. It's not going to rot. We do get a little nervous once it gets de-thawed, and then we start having to try and find arms to give it in.
Yeah.
But we're going to, I know, at least for our second vaccines, and I'm sure everybody's doing the same thing, we will take care of those folks.
Great, thank you.
Other questions out there? Jill, you had a question for me.
Yeah, KCTV5 has a slightly different take on the same question. They're wanting to know if vaccine supplies getting to us here in the metro will be affected by the weather
Yeah.
and clinics.
Yeah, we certainly are delayed here. We were supposed to be getting vaccine Tuesday, Thursday, and we heard Dr. Norman talk about this as well. It looks like, Monday, Tuesday, but it looks like there are delays in shipping, and Dr. Norman mentioned about Memphis particularly. So looking like getting shipments Wednesday and Thursday. We'll be waiting for them today, and certainly working with Wyandotte County and Johnson County to be able to get those allocations and give those vaccines as we're supposed to.
Yeah, and I know that we may have had some extra vaccine one day because of the weather, and Johnson County was not quite able to do something. So we're all working together to get it in arms. We will find an arm to give the vaccine to. It is going to be a little delayed. Just shipping's delayed, trucking's delayed, everything's a little delayed, and but the vaccine will be okay.
I would think by the next, especially when it gets really warm and warms up to about 30 and gets back to normal temperatures for this time of year, we shouldn't have any of those problems. It's really been these past 10 days.
I'm just ready for the 55 and sunshine by the middle of next week. You weather forecasters out there better get that right. All right, any other questions from reporters? Steve Lauer, how are things going in pediatrics, man?
Well, they're going great. The one of the good outcomes of this is that a lot of kids are really pretty healthy right now. Flu, RSV, the normal things we see this time of year are really not bothering us.
Are you seeing it? Have you seen any influenza yet?
No, I don't. I'm not aware that we've even had a positive.
It's almost March and we've not seen influenza.
Absolutely. Well, and again, the other one that puts especially infants in the hospital is RSV.
Yeah.
Almost none.
Yeah.
So, for any of you out there who are doubters about the rules of infection control, that is the proof.
There you go.
Not to mention the operating rooms, the surgeons, the hospital COVID wards, all those things we've been talking about how masking works. But if you didn't believe that, believe the fact. No influenza, no RSV. Holy cow.
Yeah.
Is that bad for kids to not get sick with influenza and RSV? Does that weaken their immune system by not being challenged?
No, they're fine. They have plenty of challenges, and if they can avoid those serious infections, their immune system will be fine.
Yeah. So just a thought for you. We had an earlier conversation this week around sleep, or last week. Talk to us about the sleep pattern of kids. Has that been affected by the pandemic?
Well, I think it has. I think a lot of parents are more aware of it now just because everybody's home around their kids all the time. But I think the sleep patterns of both infants and school-age kids have been really affected, again, just like they have for all families as people get off of their normal schedules. So I think they're more aware of it. It's caused more, problems, but certainly awareness and disruption within families that this is going on. So the infant patterns, especially, I think people have started looking into that a lot more and becoming more aware of it. We've seen use the term sleep regression, which I think is an unfortunate term to be using because these are just normal patterns of sleep in infants. I saw one website that mentioned the sleep regressions at 4, 6, 8, 11, 12, 15. I mean, you start adding them up. It's just normal sleep patterns of infants that I think families are more aware of. And as family sleep patterns have been disrupted, those infant ones have been as well. And now everybody's just off schedule, and it's just causing a lot of, I think, problems in those bubbled homes where everybody's there, everybody's awake and off schedule.
Yeah, I think that's probably right. Isn't it true that when you're all home, your whole day gets distorted, and then everything gets distorted? And the first rule of sleep architecture is go to bed at the same time, get up at the same time. Go to bed at the same time, get up at the same time.
Absolutely.
What about all the electronics and kids and social media? That's just got to just pile on when you're not around people.
It does, and kids, adults, everybody just because you have to be doing something, is much more on electronics even than we were before. Schools are all run on electronics, so just the exposure to electronics, to that blue light, is enhanced. One of the first things, again, is getting back to schedules and thinking of sleep as an activity. You have to get ready for it. You have to turn down the sensory temperature in the room, light, sound, actual temperature, and get everybody, your brain and your body, ready to go to sleep. So turning off those electronics for everybody, getting them out of the rooms so that you can't find your child or adolescent at 3 a.m. on the screen. All those things have to get back in place so that everybody can get the amount of sleep that they need. I don't think there's anything that disrupts anybody's life more than being sleep deprived. And I think in general, our society right now is sleep deprived, and we've got to get back to those, again, just like you said, those good schedules. You get up, you get out of bed, you start doing something, you have regular scheduled meals, and then there's that whole process of getting ready for sleep in the evening and back to getting to sleep at a regular time, and then hit repeat and just get everybody back into these regular schedules so we can all feel better, healthier, ready to go.
Yeah. So what are some warning signs for like infants or children? When should parents worry about their sleep pattern for their kids?
I'll say I think that there's a lot of, again, some of the talk of this, I think, tends to make it sound like these changes in sleep patterns in infants, especially that are normal and part of their normal progression as their brains develops. These are not problems. They're not abnormal. You have to be aware of them and be ready for them, but they're not a sign of a problem with your child. There are signs, I think, as babies and older kids get sleep deprived, they're fussier, they are more irritable, they aren't their normal selves, they can't pay attention and get things done. So I think as you start to see those kinds of patterns in your kids, especially the school age and older kids, you have to be going like, how much did they really sleep last night? And the answer we're hearing a lot is, 5-6 hours in school age kids, or 3 and 4 hours in adolescents, and that just isn't going to do it. Nobody's going to feel good and be able to function on that amount of sleep.
How about adults? How much have to sleep every?
Well,
how much sleep do you really function on, Lauer?
As far as I know, the answer has not changed. We're really kind of designed to get by on average about 8 hours of sleep a night.
Yeah.
We all know people in our profession and others.
Yeah,
we all know somebody who can get by on 3 and 4 hours, and those people are annoying. But for most of us, it's that 7-8 hours of sleep a night on a good schedule.
Yeah. What about, medicating your kids to help them to get to sleep with Benadryl and melatonin and stuff like that? What do you think? You're groaning.
Yeah, it's, again, I think sleep is a normal activity, and medicalizing it by saying, here's what you can do, you can give your kid or yourself to get to sleep, avoids the real answer, which is good sleep hygiene. Are there people who are melatonin deficient and who need some help with that? Yes. But starting kids or adults by sedating them to get them to sleep avoids those regular sleep patterns, doesn't oftentimes get good restorative sleep, and you just kind of prolong the problem. So really trying to drive to those good sleep hygiene patterns for everybody is the way we can get around that. If your child really does have persistent sleep problems despite that kind of good regimen, that's definitely something to talk to your pediatrician or family medicine doc about.
Yeah, good. I think that's great advice, and thank you for that. All right, well, let's turn to questions from the community, Jill. Let's hear what people are thinking this morning.
Well, because I'm at the mic, I get to do the first follow-up question.
All right.
And I want to know about that self-medicating, when adults do it, or if you do it to kids. My question has always been, did your body get used to it, and do you have to keep adding more, and is there a danger in that?
The answer for much of that can be yes. Your body adapts, gets used to those medications coming at it, and you can stay awake through them. So people do tend to start having to add more different medications to get to sleep. And yes, that can eventually become dangerous, and we see that a lot, especially in the adult populations with people on medications to just get to sleep, period. And for most people, that should not be the case. There are certainly, those who have true sleep disorders, and that is a serious medical issue and needs to be addressed. But for most people, that should not be the case.
Well, I'm going to take my electronic away from my adolescent husband who gets on every morning at
Whoa,
about 4 a.m.
wait a minute. Adolescent husband. I think,
He is
gentlemen, I think
acting-
we have all just been insulted here, but my wife would concur. In fact, last night, a long day, I thought, I just got to watch a little Star Trek, and it was just perfect right before I went to sleep. I was still able to crash, however. I would make note that if you're really struggling to get to sleep, one of the things you can do is read a medical article with lots of statistics. I have found that to be, and it doesn't require an increased dosing. There's really no side effects, and outside of just eye dreariness, I think it's pretty safe.
And you don't get used to it.
You
The
don't
same
get used to
dose
it.
works all the time.
Every time. It can be the same article, as a matter of fact.
Does warm milk work? Is that a myth?
I think of that as more of a myth. It's kind of it goes along with the calming down of the environment and
that's
those
it.
patterns of, this is something we do when we get ready to go to sleep. So in and of itself, does the tryptophan, whatever, in milk or turkey really make a big difference for most people? Probably not. I think it's that pattern of, oh, I'm getting ready for sleep. This is what goes with that, and a signal that it's time to slow down and get ready to be asleep.
I think that is absolutely what it does. And I think there's pretty good data about, again, that's one of those habit things. If you have a sleep habit that calms you down, whether it's meditation, which, by the way, there is so much good data around meditation helping people sleep. If you're going to do one thing to help you do it, besides the calming down, do that. What doesn't work are bright lights and blue screens and things like that are stimulating to you. Those things tend to wake up your brain. You need to have your brain calm down. And milk and cookies. Let's be honest, it's milk and cookies for
That's a
those of
good
us who've been
thing.
doing
It's a
that
good
for
thing.
years. Man, that just works.
And I would say, I think one of the things we found in our practice is that if you talk to parents about meditation, we tend to think of that as an adult activity. I think it's a great point that very young kids can be taught meditation, just that, again, that self-calming, getting ready to sleep, those kinds of ideas work across the board.
And it may even be a peculiarity of Western culture that we don't think of at first. Correct. Yes. Okay.
All right, so Wayne wants to know, this morning, the national news, the talks was around schools across the country not opening until teachers have their vaccines. A, do you think that that's something that should happen? And he believes that Kansas has done a good job of keeping kids safe. Why doesn't the national media talk about Kansas? Maybe we should tell them.
Yeah, there is some really good data that schools are safe, but now in fairness, they were safe with reduced spread, reduced density, kind of a hybrid learning system. I think that we have to be careful. That's what we have demonstrated was safe, Steve.
Right. I think everybody, getting the big picture on this, I think, is the problem. In terms of disease mitigation, all the rules still apply, and I think the successful schools are those ones who have kept social distancing, masking, in some cases, testing in place to really follow all those rules. You can do that, and the data says you can be safe in schools doing that. It's a big if, and it's a challenge to do that in every school district, depending on the resources they have. So if you read the rules carefully about those successful schools, they've been following the basic CDC rules around distancing, masking, hand washing.
And Hawk, the concept that all teachers have to be vaccinated, talk a little bit about that. What are your thoughts?
I think it's a great concept. We want everybody to be vaccinated. They are essential workers, all the adults in that school. But I think we have shown, and it has been shown since school got back in, that those other issues are more important. And that's the de-densification, decreasing the amount of people in that square footage, wearing the mask at all the time. We know, and we've heard that there's going to be a school district that is going to be mask optional. I think that's a bad idea. So wearing the mask, de-densifying, keeping people spread apart. And I think it's important to understand, too, that a lot of the spread in schools has been when the adults are not following the rules with themselves, meeting with each other, eating lunches with having those small rooms where they don't have masking and they have meetings for one reason or another. We have Zoom now. I mean, it is better to meet in person, but when you are thinking about taking out a whole department because people want to meet together in a small room, that's not the way to go about it. So I think sticking with those rules about de-densification, the hybrid learning, the spacing, the masking, that will keep the teacher safe. And it has shown to do that throughout these past, the last semester or two that schools have been back in session.
Yeah, and we showed that on the Lawrence campus,
Yeah.
right? Even with, college kids,
Yeah.
you can have a safer environment, and clearly with high school kids, I think, and younger, man, masks make a difference. Look at influenza. Oh, wait, there is none to look at. RSV, there's none to look at. It's all the same story that infection control works. And with COVID-19, it is still a brutally dangerous disease. And if you think otherwise, oh, folks, please don't be like that. It's just not true.
I mean, I think the other one is just the fatigue that everybody's feeling about this, and wanting to get people back to normal, but we're getting closer. And people have made huge efforts over a year, and what we really don't want to see is all this fall apart again as numbers are getting back under control, see this rush to just drop the rules when with vaccines, get a few more really, the rest of the semester in and it gets warmer again. We're going to be a whole lot closer, so that rush to get things done and avoid the rules could really cause a setback at this point as well.
Donnie asks, why is the flu and RSV nearly non-existent, but COVID is alive and well?
Because COVID is a super spreader. Remember back when Fauci said, what's the thing I fear most? And he said a highly respirable disease, respirable meaning you breathe it out easily, and it can be very deadly. And so that's different. And so I think what we're seeing is that because it is so communicable, what it means is that this coronavirus is more communicable. I can spread it more easily. It takes fewer viral particles to do that with than influenza and RSV. Those are just a little harder to spread, and so the rules of infection control mitigate them even more thoroughly. Coronavirus is a little easier to spread, so Hawkeye, you've got to follow the rules because we know they work, but otherwise it's going to spread.
Yeah, I mean, the infection dynamics for coronavirus compared to all of the other respiratory pathogens that we understand about and deal with on a yearly or daily basis, influenza, RSV, rhinovirus, the other coronaviruses that cause common cough and colds, they are in a separate echelon. They have different infection dynamics than what this coronavirus does. There's no seasonality related to this, certainly none that we've seen. And it's been cold weather, and it's been cold climates, and it's been warm weather and warm climates, and we see spread just the same. It's been devastating to those communities. So, but I think that when we continue to do the things that we've talked about from day one, with masking and distancing, not meeting in large groups, washing your hands, that has helped decrease the spread of those other infections that we've been dealing with that are more endemic, that we deal with on a seasonal basis or a yearly basis.
Have you checked the influenza map on the CDC lately?
Not for a couple weeks, but I do understand that out of clinical and public health labs, there's probably 800,000 or more tests that have been done, and it is running at about a 0.1 to 0.2%
so
positive
good.
rate, which normally it can be up to 5 to 10%. So it's extremely gratifying to look at those test rates. And if you look at just people going to the emergency department or their family physicians for influenza-like illness, it is a stark contrast this season, from the past 5 or 6 seasons that they have been tracking as well. So it's pretty neat.
So really, coronavirus is super communicable from one person to another, more so than influenza and RSV. Anything else you wanted to add?
Well, I think that the other one is that most of the time, influenza and RSV enters the family through the kids. It comes in through from daycares and schools and spreads up into the adults. This year, that pathway's really been cut off dramatically with hand washing, masking, a lot more at-home schooling, and a lot more at-home daycare, which is unfortunate for a lot of families, but it is kept, in terms of those infections, it's really helped keep them under control.
Angela asks, what kind of bedtime routine do you recommend for middle and high school students? and she's curious about adults. Like, what do you guys do?
Oh, Lord, you don't want to know what I do.
Don't.
All right, let's.
Yeah. Number one, don't do what I say.
Yeah.
Do what I do. Or
No, don't do what I do, do what I say. There you
Yes,
go.
there you go.
There I
So it's the same ones. They have got to get ready to go to sleep. So the stimulation, the signals to your brain that it's still time to be awake have to go away. In large part, that is light and the devices and being actively engaged in something. So getting those electronic devices turned off. Turning down the sounds, the lights, cooling the room a little bit, all those things that tell our body it's end of day, get our brain sending the right signals that we're going to be asleep soon, and just getting ready for that. What are the routines they do? If it's a glass of milk and a cookie, hey, that would be fine, but you've got to get into those regular routines at about the same time. And what we're seeing a lot is kids, I ask kids all the time, when did you go to sleep last night? Well, parents went to sleep, the kid's still awake. And, 2, 3 a.m. that nobody really knows, and then they're getting up at 7 or 8. That just isn't going to work. So same routine every night, planning about an hour before you want to be asleep is when you start turning everything down, turning down the sensory load, and getting ready. It's the same that would work for adults. So.
Do you have
It is.
bedtimes that you recommend for middle and high?
Well, I always go backwards. Say, when do you have to get up? And if they have to get up to be at school, they have to get up at 7. Then I want them to sleep at least by, for the high schoolers, at least by 11, which means everything has to be off at 10. So start from when they have to get up, work backwards, do the math backwards that says here's when you have to turn everything off. And those devices, the other one is, I need it because of the alarm clock. Well, get them an alarm clock. The devices have to be off, preferably out of the room. I don't know, that may not work just because of the incredible anxiety of being out of touch with my phone, physically unable to touch my phone, but they've got to be off.
My advice to you is to know your body. And it's very simple. We know so much of the world, but sometimes we don't know enough about ourselves. And you're going to have to make some adjustments into your life. If things are peaches and cream, life's going along great, unicorns, rainbows, then your sleep's probably going to be a little easier because things are good. But stress is one of the greatest disruptors of sleep. And so you have to respond to the stress. So how do I respond to stress? Well, I exercise a lot, and then I try and do things that I enjoy. I do love Star Trek and some shows. Ted Lasso, if you haven't seen that, what a hoot. But that's not what I want to do right before I go to bed. That's a few hours before I go to bed. And then before I go to bed, I try to do things that are going to be a little more relaxing. And whether that is read or to meditate or just to sit, or honestly, I can answer a little bit of email, I can read a newspaper, I can read an article. Those things slow the day down a little bit. And to your point, they signal a certain pattern. And then I can kind of lay in bed when I first get to sleep, and I just sit there and I let my mind wander and I think and have a little daydreaming. And then pretty soon I find myself wandering into sleep. The other thing that works is your exhaustion. So if you work yourself to death, sometimes you get to sleep pretty easily. And that, in the middle of the COVID crisis, unfortunately, has been a recipe for sleep. It's also a recipe for sleep deprivation. But in the middle of the COVID crisis, I think that's how it's gone. What do you do?
Yeah, we've had Dr. Stewart on a couple times talking about, I do the hot shower, and that helps kind of calm me down and get me ready for bed. But other than that, I do listen to a podcast or two, different ones that are kind of calming. And we know that there's apps out there now for meditation and calm. And so
They
you
work,
listen to
right?
those. And by about the first 5 or 10 minutes, I'm asleep because I don't remember anything about the podcast. So,
Yeah.
But it is that routine that I do on a nightly basis. And then for my kids, certainly get them up and devices are off at 10 o'clock. So.
Yeah.
And I think some of the things about, meditation, whatever that means to you, of just that calming down, whether it's listening to the podcast or some routine you go through that just slows things down. So I think almost anybody of any age can do that. The other one that has been, I think, a problem is it's hard to go to sleep when you're not physically tired. And the lack of exercise, the lack of movement as people have had to stay home is a problem. So during the day, trying to find that physical exercise time as well. Do something. I mean, you don't need to be at the gym. You can there's all kinds of things you can do that don't require equipment in your home. So just getting some physical activity in planned for your kids during the day will also have them a little more physically tired at the end of the day and more ready to go to sleep.
So Joellen says she listens to audiobooks. Isaac says he takes a hot bath. Sounds like that they're doing some
But
things.
those are all
Christy,
good things to relax with, right?
Yeah.
That's the common theme, and then they probably do it pretty consistently. So.
we have some more masking questions. Christy says, if masking is so effective against influenza, why haven't we done it in the past?
Well, Dana, some places have done it. You know,
Yeah.
like we
Yeah.
see some of the Asian countries have
Yep.
been doing it for years. It's not new news. But if you've seen how hard it is to get people to wear a mask with
Yeah.
a deadly virus, imagine how hard it is to get them to do it regularly for influenza or RSV.
And I think that's one more point, that influenza is not coronavirus and coronavirus is not influenza. We haven't seen the capacity issues, the healthcare workers, the drug utilization issues, the death issues that we've seen with coronavirus. We've never ever seen that with influenza, except for the 1918 pandemic. And again, probably a lot of those deaths really had to do with secondary bacterial pneumonia anyway. But we just haven't seen the amount of devastation with influenza, even though there are a large number of hospitalizations and deaths every year. And what, about an average of 150 children per year
Something
taken
like that.
with influenza compared to coronavirus? And we had how many more deaths
Oh,
halfway
usually-
through the coronavirus pandemic than we did?
You know,
Probably double
18
the
to
deaths.
40,000 influenza deaths in the U.S. a year, and we're over 10 times that easily, maybe almost 30 times that on a lower year. So again, these are not comparable, and by the way, we're not done with coronavirus. We're going to be well over 500,000 in the United States alone. So that's orders of magnitude.
So,
different.
yeah, I mean, the short answer is we just haven't seen the same types of, devastation and again, essentially capacity issues and really shutting down cities and communities that we have seen with coronavirus. We haven't seen that with influenza.
All those being said, I think we will want to reconsider going into this coming fall what counts as normal, safe, and kind of acceptable infection control routines going forward. And the reality is that some masking, washing your hands, don't go to work if you're sick. I think a lot of those rules that we've tended to say and have not always clearly followed very well, I think we're going to need to think about them because they are having an effect on kids and influenza and RSV. And while the numbers are nothing like coronavirus, those still are important diseases that have a serious impact on children every year. I think we're going to have to take a look at those as we head into next fall.
It was a marker of strength that historically you showed up to work even when you were sick.
Yeah.
Exactly.
Been in KU for 31 days. I've missed 4 or 5 days. I can count on one hand the number of times a cold or something like that kept me at home. Usually it was something like a flu bug I was throwing up. So, but really, I just came to work. I always come to work. That's just how I was raised. That's what we do.
Yep.
And then last year, a story about myself. I got a little sick. I had the flu shot around my 60th birthday, and I was here and I was sick. I was trying to wear a mask. I didn't feel very good. I didn't always do it. And I said, I'm fine. I still have a cold. Well, I had influenza. I think I had to write 30 scripts for Tamiflu that year because I was around so many people I had contaminated. And, when you look back at that now, it just seems so quaint, doesn't it? and maybe a little stupid, too. And so I think that you take a little bit of wanting to be a little bit of a martyr, or you want to be a he-man or he-girl or he-woman or whatever, and you mix that with a little bit of stubbornness and a little bit of pride, and pretty soon you can make a lot of folks ill. And I think what we've learned, and it's an important lesson, there are silver linings to this pandemic. What we've learned is we can keep each other safe sometimes by just staying at home and wearing a mask and doing those things. And the other silver lining is that with Zoom, you can actually still work. And so you can get the best of both worlds.
There's a couple that have questions about all this mask wearing, all this hand washing. Are we weakening our immune systems?
Yeah, we knew that was going to pop up. Well, we're not getting sick enough. That's going to turn off our immune system. Hawkeye, what do you think?
No, short answer to that is no.
Not so much.
You have enough antigen sampling in your body with, breathing, taking in through your lungs, your gut, all of these things. The immune system has been going on as long as sharks have been around, longer than that. So But the short answer to that is no, you are not weakening your immune system at all.
And just remember, our bodies are inhabited. We coexist with all sorts of bacteria. And so our bodies are constantly around that. Plus, you're around your cats, your dogs, and everybody else. You're still going to get plenty of exposure. But not getting influenza, not getting RSV, I think that's a good thing there, Dr. Lauer.
There's a big difference between, like I said, all the bacteria that we live with every day of our lives and pathogens, things that are going to kill us. And we want to make sure that we're fighting off those deadly viruses and bacteria, which are a relatively small group compared to what we're coexist with all the time. So yeah, our immune systems are remarkable structures and are exposed to thousands of antigens every day, despite our hand washing and masking.
Yeah, just the very air you breathe. And just to say, when you look at the number of hospitalizations, whether it's adult or kid, the adult numbers have been covered up a little bit by the number of COVID patients, but the reality is all the other disease numbers are down. And I know for children, they're really down.
Oh, yeah.
Which just says to us, all those infections are causing lots of asthma problems, lots of COPD problems, lots of heart failure problems, lots of kidney problems. All those things get influenced by these infections that we get. So are we going to be healthier without a lot of viral things? Yeah, I think the answer to that is yes, Hawk. What do you think?
Yeah, absolutely.
Yeah.
Okay, Carol and Joanne want to know, A, maybe wearing the mask, will flu disappear and go away? Will we have it die out? And B, will the cold weather kill COVID?
Yeah, well, just to be clear, cold weather's not killing COVID, neither is hot weather. We witnessed that. And you think, well, it's really cold right now, and the COVID numbers are going down, so it's because of the cold. Yeah, well, the numbers are going down in Arizona, California, and it ain't this cold, so I take the cold weather thing off the table. Now, can mask wearing eliminate influenza and RSV?
No, I don't believe there's going to be eradication of influenza because we know that other animals can be infected with influenza as well. It can serve as intermediate hosts. And then once it gets into the human population, it can probably rebound pretty quickly.
We've eradicated one disease in the history of mankind.
Smallpox.
Smallpox. So we got a long way to go before we worry about wiping out influenza.
Yeah, and that was with a lot of vaccinations.
Yes,
too.
yeah.
Debbie has read that a lot of countries are not as interested in AstraZeneca anymore. Is that true? And why do you think that is?
AstraZeneca doesn't appear to be as effective against the South African variant, or B135, and I think that's maybe be a little bit less of interest. Plus, to be honest, the trial has just taken a long time. They've had a few stumbles, so I think there's been a little bit of concern about it. However, it is being used, and I think that it still can be highly effective against most of the viral variants, and we're waiting anxiously to see what the outcome of the United States trial is.
Yeah, I see different news about this every day, and there's people who are doing it, and then there's drawbacks and rollbacks of doing it. Overall, we should say that the World Health Organization has endorsed it and provided EUA, emergency use authorization for it. So at this point in time, when we get the full data here in the United States and it's reviewed and we can use it, we certainly want to use it. It's one more vaccination we can use. But I think there are mixed stories depending on what.
And it's incredibly stable at room temperature. It's easy to deliver. I mean, that's one of the reasons people want to use it, because it is so good against all the other forms of this except B135, or at least that's what it looks like from the international data. It's being used. And I think that we're anxiously awaiting the U.S. data, which should be delivered sometime in the next few weeks. We should hear it really soon. And speaking of data, we should be getting the results of the J&J EUA out pretty soon, too. That should be popping up.
26th or so,
Yeah,
late
and
20s is when they're going to be meeting to
Okay, to review it.
Kevin Alton's on.
Yep,
On that Monday. Kevin is on that Monday.
good.
So Jean and Linda, they have situations where people are going to bed okay, but then they're waking up.
Oh, gosh, that is a problem, man. That is so often stress-related, Steve.
Yeah, well, exactly. I think that's has a lot to do with it's just that stress. Our normal sleep cycles, everybody almost wakes up 4 or 5 times a night. Anyway, we have these periods of really deep sleep, and then we're kind of almost awake. And that stress, that lack of, sometimes I think that lack of exercise, being really tired, allows you to kind of break through that cycle where normally we head back into sleep and we wake up. Across the board on that, the answer, I think, is to try and minimize what happens when you wake up. It's just like for infants, those who you have to check on, you don't make it a big event when they wake up. It's just check on them, you're okay. Let's not, turn on the lights and start playing. Can we just calm everything down? This is normal. Let's get back to sleep. And I think for the older kids, it's the same kind of one. Let's not, pick up my phone and start looking at things. Try maybe get a little water, but let's not go eat. Get activity, get out of bed. Let's try and calm that down. This is okay. I'm okay. Let's just sit here for a few minutes and see if we can go ahead and get back to sleep, get back into that sleep rhythm.
Marguerite, she says that she wants to know if you have any suggestions for a 2-year-old who is having night terrors. And the 2-year-old
terrors.
apparently had general anesthesia, and it's kind of coincided with that, perhaps.
I would say night terrors are, again, just like these sleep regressions, they're a normal sleep development pathway. So they're not a pathology, they're not a sign that something is wrong. They are a part of, as their brain is going through these incredible developmental phases of growth and pruning and trying to figure out all these connections, they hit this phase where they're able to be, in sleep terrors, they're really dreaming, they're not awake, their eyes are open. So they're moving, but they're connected. I think of it as being connected to your dreams, which as you get older, you stop doing. So while they look scary, they're not in any way damaging to the child. It's the same one. Is it a safe environment? Let's just help them calm down as quickly as they can and get back to, well, they're really still asleep, so getting back to being with their eyes closed, lying down. So just a safe environment, let them calm down and get back to sleep from that. Whether or not it is, again, I think many children have those without having anesthesia, so I think that is the perfect age to be hearing that. Probably unrelated, and the treatment would be the same. Let's just work with calming down that environment and getting them back to being asleep.
I think it's always harder on mom.
Oh, yeah. Well, who goes and checks them out?
Yeah, or dad, whoever is doing that. So one more question.
Please.
Bailey wants to know, is white noise or noise machines helpful or harmful for kids? Does it become a crutch? Should they listen to calming music instead, or does it matter?
Personally, I think of the ideal environment as quiet and trying to cut down that sensory input so that we can get to sleep. I think there are some people who do better with a little bit of that background noise that prevents other noise and other stimulus from getting through to them. So in that sense, it can be helpful. It's got to be truly background, not something that your brain's engaging in, which is where I think you cross the line to music. That's something you're actually interacting with. The point of white music is background. You're not really engaging with it, and it's preventing other things from getting to you. So if that helps, I think sleep is more important than worrying about if it's a crutch. So if it's working for now, go right ahead with some white noise.
All right, so this has been a great topic morning. And by the way, my white noise when a 15-year-old Steve Stites was out here was Jonathan Livingston Seagull, Neil Diamond. It was great.
Yeah.
It wasn't quite the right
That
white
puts you-
noise. So it's fine. It was the ocean wave along with the seagull sounds, I think.
Right.
There you go. Hey, tomorrow we're going to hear from an expectant mom on why she got the COVID-19 vaccine. Her baby is due in March, so hopefully she is still able to come tomorrow. And Dr. Carrie Weinecke, the chair of OBGYN, joins us to talk about COVID-19 infection rate amongst expectant moms and advises us what her patients should do around getting the vaccine and avoiding the virus. And I think we're going to talk about some of the COVID-19 effects in pregnancy and what happens in pregnant moms because they are at higher risk. So, final thoughts, Steve Lauer.
I think everybody needs to get really working the next couple months on getting back to those routines, getting up, eating well, getting some exercise, getting a good sleep routine at the same time every day. Really boring. Nobody likes to hear it, but that's what I think is going to make the biggest difference for everybody in the months ahead.
Yeah. I think adults and kids are all affected in different ways, and it is sleep, and it is their daily lives. We have really been able to start to move past this divisiveness that we've seen for the past few years. And as we enter the Lenten season now, I just want everybody to continue to understand that it will take time, but we are able to get through it if we use each other. with compassion and thoughtfulness, we will be able to get through this. Vaccines are on the way. We saw that rates of new infections and hospitalizations are declining. It's getting warmer, so just take it one day at a time. And if you run into problems or anything and have issues with people, just use a little bit of compassion and thoughtfulness, especially in these next few weeks, because we all need to get through this together. And I think we've done a good job so far, but it can be better.
It is getting warmer. We've gone from -7 degrees yesterday to 7 degrees today. So that's like a big heat wave. Watch out. I think, Hawkeye, you just said it perfectly right. That's great. We talk every day about the rules of infection control. You want to get good sleep? The number one thing you have to do is try and remove as much stress from your life as you can. Stress is the number one challenge to good sleep in the United States. And how do we manage stress around COVID-19? We do the things that keep us safe, because that will help us sleep. So the rules of infection control, which travel with you everywhere you go, wearing a mask, keeping your distance, washing your hands, don't go out if you're sick, don't be in a big crowd, all those things we tell you all the time. You know what else they're going to help you do? They're going to help you be a little less stressed. They're going to help you get some sleep. And to Hawkeye's point, we're in it together. We can go to sleep together. You don't mean that in a bad way. But we can also take care of each other together. Tomorrow we're back. We had a great program. Thanks a lot to the folks who are here today. And remember, in the meantime, there's still no place like home, especially in your own bed.